Hi, I'm Diane Silva and I'm making a video for my public speaking class, and I'm going to be talking about mental health, and I'm going to be talking about mental health in children, and I'm going to be mentioning some ways on how we can help. I'm going to be sharing a lot of stories with you as well. Hopefully you guys enjoyed this video. Thank you. One of the stories that I'm going to be sharing with you today is the story of my brother. He has allowed me to talk with you about his diagnosis, schizophrenia. He was diagnosed at a very young age. Growing up, he was the top of his class. He was abnormally smart. He did everything right. He was an aspiring preacher. He went to college. During his freshman year of college, he made some decisions that would affect the rest of his life. One of the decisions he made was to try a street drug called marijuana. At that time, we asked my brother, why did you want to try marijuana? Why did you make that decision to try the street drug? He stated he wanted to expand his mind. Lack of education for drug use, and I'm talking serious medical education on how all of these drugs that my brother tried after the marijuana, such as cocaine, mushrooms, affect your brain chemicals and your cells, I believe led him to make these decisions as an adult. My brother made his own decisions with his free will as an adult. This brings me to my next topic, which is education for children. All of our youth are our future. I know this sounds very cliche, but it is still true to this day. Our youth need to be educated. They are learners. They hear, they see, they smell, they do everything we do. Not only what we do, but what they see out in the community, also what they see in schools, what they see their family members doing. Education is key. My point is that these kids will grow into adults who will be making their own decisions. Hopefully they don't make the same decisions as my brother, which he came to the point that we were unable to stop him from making these bad decisions that had an everlasting change to his life. Studies have been done on younger children that show that even at a very young age, ethical dilemmas arise. Kids at young ages start making decisions for their little lives. They start making decisions that include things that are right or wrong. It is our job as parents, it is our job as aunts, it is our job as uncles and grandparents to educate our children on mental health. It is also the school system's job, I feel, to do this as well. Keep in mind that there are some treatments in practice already in some school districts, starting at young ages such as middle school. However, the younger, the better. My job as a mental health nurse in children and in adults has shown me that the need is great. The need is there. I hate to sound like a broken record, but we can help change. We can help individually change the world of mental health. It starts with you, it starts with me, it starts with auntie and uncle and grandma and grandpa. Also with our teachers, our administrators, and our nurses in the schools. Mental health should be taught as a subject in school. The same way sex ed is taught in school, the same way math is taught in school, and this is because of our rising numbers for depression and anxiety in children and in adults. Our suicide rates are up. Some studies show that depression can be a #1 killer soon. We need to take action. We need to help our children at home, and we need to advocate for our children to receive mental health education in school. During my time as a mental health nurse for children, I came across this young lady. She was very smart. She was very inspiring. She was very creative. She was also very insightful. She had everything going for her, including a full ride basketball scholarship, despite the fact that she had no leg below the knee. Her family was very poor. This was a great opportunity for her to go to college and make something of herself, which she definitely would have. She had so much going for her, like I said. Unfortunately, she didn't last in college 6 months. Despite having all of the resources available to her at her school, she had psychiatry, she had nursing, she had medication help. She made the decisions not to continue with her mental health as an adult. She came home. She spiraled down into a very deep depression that she could not get out of. And unfortunately, she did lose her battle to anxiety in 2016. This brings me to my hope that we can have mental health in school at a very young age. She did not have the help when she was younger. She didn't get it till she was older. Again, I am aware, we are all aware that as an adult you make your own decisions. However, I feel like if we can start a little bit sooner with mental health, and if we can dig a little bit deeper with mental health education for people and children, this can save some lives. I know that it would be really hard to kind of get this put into play in an education system, but with, as I mentioned earlier, with depression climbing and suicide climbing, rates are climbing, it is very important that we do something. What we're doing now is not enough. Right now is the time to dig a little deeper for our kids in regards to mental health. Right now is the time to make these changes come alive in the education system. As we all know, coronavirus has impacted the world. Schools have stopped or paused or slowed down. This means the same for mental health resources and mental health in the schools. Right now is the best time to put this into action and to help our kids with mental health and to help our kids grow into these adults that are going to be making those life-changing decisions. Some ways that we can help mental health now on an individual basis: if you have children, if you have cousins, or if you have nieces and nephews, any child that you see, please speak to them about mental health. Obviously, it's not the best thing to scare them, and it's not the best thing to show them a bunch of numbers and statistics, but speak to them on their level in regards to mental health. This is going to help change a lot. The younger you start, I feel like the better it is. We need to teach our kids to be kind and to be thoughtful and to help others in need. The county I live in has a mental health crisis line. This line is available 24 hours a day, 7 days a week. I know most counties, surrounding counties in this area, have the same type of line. I am one of the nurses who answers that line, so I know that it is there for most counties. If you or a loved one or anyone that you know of needs resources, and this could be anything, I cannot tell you how much resources are out there. Just call that line. It's called the Access line, and you can Google it. Google the county that you're in, and then Access line after that. And this is basically a resource line, and you can call and get resources at any time of the day for you or your children. Thank you. Hope you guys enjoyed my video. And to whatever student is watching this video, congratulations, you made it, we made it. And thank you, Mr. Guay, for all your support. Thank you.